Good afternoon, Tampa. It's Mayor Jane here for our Facebook Live. Thank you all very, very much for joining us today. We have an incredible guest, as we do every day, but we have Dr. Doug Ross of Advent Health with us today, and he is going to talk about the reopening and the virus and potential surges and steps that we need to take. So we're very, very excited to get to you, but let me make a few announcements first. The cases of COVID-19 are 1,300 in Hillsborough County, including 29 deaths. We actually had 3 deaths just recently. In Florida, 36,897 positive cases with 1,399 deaths. Now, as I have said many times, the number of cases, we have been on a downward trajectory, and you just have to look at the proportionality. The positive cases are increasing, but that's because the number of tests are increasing dramatically. And so we still continue proportionally, percentage-wise, to have a reduction in the number of positive cases. So we are starting. Dessa's in here. Dessa, I have an office dog, Dessa the office dog, and so she comes in here and mainly tears things up in the studio while we're having the Facebook Live. So hopefully she won't be too much of a bother today. She ate a water bottle the other day. So we have opened up our parks, and you can go and look for a list of those parks that are open and the amenities that are included. All contact sports, youth sports, recreation equipment, the actual recreation facilities, the bathrooms, those are all still closed, but the walking trails, our beaches, our dog parks, kayak launches, certain boat ramps, those are all still open, and we've added to those. Clearly, the new openings are all of the dog parks, the beaches, and then we added 13 new parks to that as well. So please pay attention to the social distancing while you're enjoying our beautiful parks. So the City of Tampa team has spent several days, and we've worked all the way through the weekend for this reopening opportunity today. And so what we are looking at is what we were looking for was a way that we could help our small businesses, specifically retail and restaurants, that as of today are able to open up with 25% occupancy indoors. And so the plan that we have crafted in concert with a number of restaurant and retail owners is to provide seating and retail space outside of the locations. So we have closed down 7 partial closures of streets throughout the city of Tampa. And then those restaurants or retail that don't abut a street but have a parking lot, they are allowed to use a certain percentage of parking spaces to exclude any handicap spaces to set up outdoor tables and chairs as well. All of the tables have to be 6 feet apart, and that's measured chair to chair. And the restaurants that are participating have to take reservations, and individuals will be allowed into these closed off segments by reservation only, so that we don't get large crowds. I am fully aware that tomorrow is Cinco de Mayo. The city is not back open 100% for business. What we are trying to do is help out the restaurants and the retailers that have been knocked to their knees economically, and to help them by adding seating outside. But it is not going to be a party tomorrow. They have to follow the rules, and if the establishments don't follow the rules, they can't participate in this outdoor dining. So again, we're trying to do everything we can to help everybody get back up on their feet, but we need not only the businesses to cooperate, but we need our community to cooperate as well. So thank you guys for getting the word out on that, and we expect that that it'll be a great beginning tomorrow leading up into the weekend. We're going to have code enforcement and police officers out as well, and they will be controlling the ingress and egress to these locations to ensure that we don't get any large crowds in that wouldn't be able to maintain the 6 foot distance separation. So very, very important. Remember that you can get tested now for COVID-19, whether you have symptoms or not. So please call the Hillsborough County line. It's 813-272-5900 to get an appointment. You don't need insurance, it's free, and you don't have to have symptoms. You can get tested if you want to get tested. So please call 813-272-5900 to make sure that you can get tested and find out if in fact you do have the virus, if you've been exposed to someone for whatever reason. If you want to get a test, you can get a test. We still have within the city of Tampa, we have Raymond James Stadium, and we also have Lee Davis Center. And Advent Health, I went out when they opened up. They have a testing site that is at Adventure Island. If you have insurance, they'll take your insurance. If you don't have insurance, they'll give you a test and you get your results right there, where the other locations you have to wait a day or so. So again, go on tampagov.net and look for those locations, or Hillsborough County, call that number or go to Hillsborough County's website. Please go, while you're on Hillsborough County's website, fill out that survey. I've talked about this many times, that as we open up, we have to ensure that we have a very accurate picture of where this virus is at in our community, both in numbers and where it is geographically. That's why we're increasing the amount of testing. That's why we're ramping up the contact tracing. So if someone is positive, we can track down all the individuals that you've come in contact with, test them, and quarantine if necessary. And that's why USF and Hillsborough County have put together this syndromic surveillance system, and they're mapping geographically those individuals that, not individuals, but those cases, no names associated, but where the positive cases are geographically, and then individuals who have taken the survey that feel that they may have symptoms, they're also mapping those geographically, and individuals that present themselves at a doctor's office or a hospital, they're mapping those as well. The point of all of that is so that we can identify hotspots or surges and get resources down in there quickly so that we don't have a large spread of this virus. So that's very important. Please go and get tested. Again, I'm going to continue to ask you to take the census. It's incredibly important. It takes a matter of a minute or so. Go on there and make sure that you and your family are counted. That's how we get federal funding into our community. And it's also how our political representation in DC is determined by population. So it's incredibly important that you go on and you fill out that census, regardless of, if you're here in the community for whatever reason. Make sure you go on the census and you fill that out. And you can go on census.gov and fill it out. Doesn't take more than a minute. Please do it, or fill out the paper sheet that you got, the survey, and send that in. So very important. Make sure you're going to our website for all kinds of information with COVID-19. We have it covered there. It is a very, very robust and informational website at tampagov.net. Incredibly important. Now we get to the important part. Our esteemed guest, Dr. Doug Ross, has served as senior physician surgeon and was in academic practice for over 20 years at Yale. You don't even look like you're 20 years old. Subsequently, he has served in multiple leadership roles in healthcare, including chair of surgery, chair medical informatics, chief clinical officer, and chief medical officer. So Dr. Ross, we are incredibly lucky to have you in our community. And thank you so much for taking time out of your busy schedule to talk with us about this important topic. So as our state starts to reopen, I keep talking about uncharted waters, and I said, I told someone that, you know, we're as a community, uh, especially in positions of leadership, making decisions with 10% of the information and 100% of the responsibility. So we're doing the best we can to make decisions that are in the best interest of our community. So as we start to reopen in slow incremental stages, talk about the importance of the continuation of social distancing.
Well, first of all, Mayor Castor, thank you very much for having me tonight. Today, it's really quite an honor to get to speak with you and the rest of Tampa. Really excited about that. Social distancing, I think your plan is solid in terms of restaurants having that 6 feet apart, tables, decreased volumes in restaurants, outside ability. We have to really maintain social distancing. It's a critical part of blunting the curve around this disease. Of course, masking also, and we can talk a little bit more about masking, very important, really to protect others rather than yourselves. It's, you're actually doing your social or civic duty by actually wearing a mask out in public. So I think that's very important. In the hospital, for example, we've limited visitation, we've decreased the number of access points to the hospital, which are really important so we can adequately screen people before they come in. We have decreased the amount of chairs in our cafeteria. We have also created seating, marked out seating to create social distancing in our waiting areas and such. So we're trying to do our part too in social distancing, as well as protecting people with masking. There's not anyone in this hospital, except for me maybe right now, that doesn't have a mask on, and because we believe that it's so important that both patients and our staff are masked.
Yes, and that really is. So we tried to get, or I tried to get, a masking order uh, through our emergency policy group, and well, I was not successful. And so what we did is spent a weekend calling around to organizations in businesses in our city and got a number of all of our grocery stores, Publix, Sam's, Walmart, Winn-Dixie, our pharmacy, CVS, Walgreens, Home Depot, the airport, Dunkin' Donuts, just a number of groups that signed on to require their team members to wear facial coverings whenever they were face to face with individuals. And I heard the other day, someone told me that they had made a trip to Home Depot and that Home Depot had two lines, and those individuals that had a facial covering were allowed to go right in, and the others had to wait. And so again, a way to encourage individuals to wear the facial coverings, and that's a part of um, our business approach with the restaurants. Is that anyone that is dealing with the public has to wear face coverings. Now, clearly, while you're eating dinner, it's an impossibility, but again, anything that we can do to encourage individuals. So what do you think, are there recommendations on the proper masking of individuals, in your opinion?
Well, certainly you want, well, actually, it depends when you catch me. I'll, during the workday, I'm wearing a, surgical mask kind of thing. And then I've, on the Surgeon General's site, the United States Surgeon General's site, he has got a great video on creating your own out of a bandana with a couple of rubber bands. And so you'll find me off hours wearing a bandana. But the most important thing I think is before you put on the mask, you should wash your hands, uh, put the mask on, make sure it's snug to your face. And then after, and don't touch your mask if you can during the time you're wearing it. Of course, a lot of people don't. It should cover your nose and mouth. I've seen plenty of people just covers their mouth or hang off to one side. Doesn't really do very much with that. And then when you take it off, first wash your hands, take it off, put it in right into, if it's cloth, you want to put it right into the washing machine so it doesn't get handled again, and then wash your hands again. And I didn't really mention that in our social distancing, but importance of, a lot of hand washing having shown to decrease the spread of the disease, at least to yourself. And the other thing I want to emphasize, I said that before, is that mask is preventing you, potentially asymptomatic carrier of COVID, from giving it to someone else. And so really you're doing a civic service to actually protect others by wearing that mask. So it's not really protecting you so much as it's protecting others. So I really encourage that.
Okay, so we are in a phased approach that we talked about of getting services back up and running across the city, the county, and the entire state. How are you making it safe for patients to return now that elective surgeries are allowed? How are you and your organization making it safe for them to come back?
Well, first of all, let me just say that Advent Health, we've been working on the plan of the pandemic now for months and months. I mean, really impressed with the overall force of the company that really brought a lot of expertise to bear to prepare to treat pandemic. And we're really applying the same sort of strategy to really getting us back up and running. So we've created a lot of strategies. Number one is we are testing our entire staff. Currently, we're in the process of every employee, every physician, provider are all getting tested for COVID. We have started to test every admission to the hospital for COVID. And so we plan even surgeries, et cetera, all will have been tested ahead of time for COVID virus. Now, depending on the severity of their illness, not the COVID illness so much, but as what they need, we have ways to treat COVID positive patients in a way that protects our team members and others from getting COVID. And then we have designated areas of care for patients who don't have COVID. And as you've probably seen in the press, really, we do believe that people have postponed things that they normally would not have postponed to go because they shied away from coming to hospitals. And if there's one message I really want to get across is that it is safe to come to hospitals. We are prepared to take care of people who don't have COVID, but who have heart disease, the whole gamut of diseases that really you should be presenting yourself to the emergency room. And know that when you come to our emergency room, and I'm sure it's true of others, that we have designated areas for patients who we don't suspect at all to have COVID versus patients who we suspect have COVID, and it's very safe. So we temperature check everyone coming into the hospital as well. We run them through a series of questions around exposure and limit patients who give any positivity to those questions. We restrict their access. We have limited the entries. We are ready to take care of the patients who don't have COVID through elective surgery. And we're going to phase that surgery and those procedures in over this week because we believe we want to make sure that we do this in a safe manner as we grow back into our regular volumes.
Excellent, excellent. And I happened to be, after I retired from the police department in 2015, and I was able to join boards, of issues that were very important to me, transportation, mental health. And I actually was on the board of a hospital, and people have no idea. I mean, when you think about it, clearly individuals come in with all sorts of infectious diseases and things, and the general public has no idea the steps that hospitals take to ensure that there is no spread of diseases and things. So I can only imagine what you have done on top of the normal procedures. All right, will people in the community be able to continue to be tested for COVID-19 as hospitals go back to general services? Well, I guess what you just said, it sounds as if you're going to increase the number of tests now that you're doing the general
That's
procedures.
correct. And, you mentioned it before, Mayor. Advent Health has set up a drive-through testing site right at Adventure Island that was going to be open at least till the end of this month. We have the capability of testing roughly about 2,000 a day through that site. We ask that people try to pre-register. It's a little simpler. They can go to Advent Health, Advent Health Coronavirus Testing.com, Advent Health Coronavirus Testing.com, and pre-register. But there's no out-of-pocket costs, as you spoke to, and we will be able to test you. It's a saliva test, so it's very simple to do. It's nothing very intrusive. Although I've taken that test, I've done the test, and we have a certain volume of saliva we need, and it's a good 10, 15 minutes. I was surprised how much it takes to get the volume you need of saliva. Not to get too into
too
the
technical. Yeah. It's we talk about the the swabs, and people say that either they have the sensation that you're touching their brain if you do the nasal, or you're touching their toes if you're doing the throat. So, but still, a couple of seconds of comfort, and the wealth of information that's necessary.
And patients were still a lot of the patients were still testing with nasopharynx. It depends on where we are and the capabilities of the place. But
and then also
very effective. Yeah.
With your testing, you get the results. They get the results right there, correct?
Well, I think as the volume grows, I'm not. I think that really that varies really depending on the volume of the testing occurring there. So it can be a little bit. You need to what we'd call you or let you know on portal things like that.
But the point is to have more, to increase the volume, to get
more. You need to increase the testing across Tampa Bay to really understand exactly what you said, which is epidemiologically where are the hot spots, where are there's a cluster of patients who need to know about it, and also then deal with it by quarantine, or at least knowing and trying to avoid exposing others. So that's critical, very critical.
Okay. Now let's talk a little bit about, I think that it's a given that as we start to open up, no matter how thoughtfully we do it, the number of positive cases are going to increase. I mean, we have done so well with the flattening of the curve and the minimal number of cases and associated deaths because everyone has stayed at home and they've adhered to that. So now as we start to open up, people are going to come in contact regardless of the steps that we take. So it's all about controlling that. What's your opinion on that surge, and any ideas of what we may see going forward?
Well, I would agree with you, Mayor. We are going to see an increase in cases. It's just inevitable. Really, the whole strategy behind the stay at home, safer at home, et cetera, models that you have, and I applaud you for doing it, taken on, was really to blunt that curve so that the health systems in Tampa Bay were not overwhelmed, as we've been seeing in New York and other areas, to the point where they're not even able to care for all the people that they were seeing. And so we really need to continue to do that work, like we talked about, social distancing, less than 10 people, hand washing, mask wearing, all this to maintain as best as possible a blunting of the curve. It may not be as blunt as when we were all at home, but if we continue to do what we do, we won't overwhelm the health systems to the point where we're not able to be cared for ourselves when and if we get the disease. So I just really encourage people to continue those strategies. And yes, we are going to see an increase, but again, with our economy doing what it's been doing, and these businesses and people out of work, I applaud you for this phased approach in bringing back businesses to the area, and we're ready to take care of those people.
Well, thanks. And so here we've seen, we've had the benefit of seeing other areas, and I have the privilege of talking to a number of other mayors across the United States from large cities that have been through this and seen the worst of it: Seattle, San Francisco, New York. And the one thing that was consistent from all of those, that the question asked, if you gave one piece of advice, it was shut down your city as quickly and as thoroughly as you can. Now, as we open back up from those same cities, we have seen, and others, not just those, but others, we have seen that there is a disproportionate impact on our Black and Brown communities. Quite often in those communities, we have multi-generational living, and specifically in the African American community, there was this myth that Black people could not get the virus in the beginning. So I believe we've dispelled that. But so I see that issue with the multi-generational of young people who may be asymptomatic that are bringing that into those who can least afford to have it. What are your thoughts? Because the estimates vary widely. What are your thoughts on the percentage of individuals that may be asymptomatic with this virus?
Oh, that's a challenging question, I would say. It's really, because we haven't tested large populations,
Mm,
even in China and other areas, they're finding the asymptomatic percentages to be much higher. And I've seen some data that actually drop because once you start testing large populations and finding the asymptomatic positives, it decreases actually the percent mortality, right?
oh yeah.
Because of the disease. And I've seen some quotes as low as a 1% mortality rate, which is close to flu. So, so it'd really be hard for me to guess. I would say in Tampa, we've been very lucky. So I've seen some of our Advent Health information say that something less than 1% of the population has been currently infected for this phase.
Okay.
So, but to answer just how many, are
Yeah.
asymptomatic, it's really hard to say at this point.
Yeah. I've read articles and seen from, around 20% and higher, and some
Right.
lower as well. But until we get a very accurate antibody test, it would be difficult to say. Now, one of the things that I feel, and of course I am, um, a little partial to my city because I was born and raised here. But one of the things that makes Tampa and the Tampa Bay area so wonderful is the way that everyone works together. Everyone comes together. We come together to celebrate, and we come together when there's an issue, and that really has brightly shined in during this virus, the ability to bring that down. But another example of that is how the competing hospitals have come together, and everyone has worked hand in hand to bring their best A game to fighting this virus, and that includes Advent Health, TGH, Baycare, and HCA. Everybody to get working together, and so I commend you and your organization for the part that you have played in keeping our residents safe and healthy as well.
We're very
And
proud to
that,
be part of the healthcare system, and I think I'm proud that we've been so good at coordinating our care with
yes,
uh, our other systems. So thank you.
yes. And I told Dr. Lockwood, I said that I have just enough medical knowledge to make me extremely dangerous at this point. So I always start things with all my time, all my years spent in medical school, which zero.
That's
So what are some of your final thoughts as we work to get the city of Tampa, back up slowly and moving forward?
Well, I do think I like that you emphasize slowly. I think we have to. This is, we're sort of in. I'm glad to hear that you've coordinated with other mayors across the country to sort of understand how to do this or what you experience as you do it. And I think slow is good. I think that I'm very impressed by our leadership entirely, and what you've made great bold decisions. And then going forward, of course, I'm a broken record about social distancing and masking, washing hands. This is not going away. Just because the city is opening slowly in a phased approach does not mean we are out of the woods. What it means is that we have not overwhelmed our health system and will continue to do that if we apply these strategies, across the board, whether it's in a hospital or whether it's at, walking on Bayshore Boulevard, you want to apply those strategies.
Yes, without a doubt. Now, what are your thoughts on herd immunity?
Right. Well, we understand that, when you get to 50 or 60% infected, that you get to herd immunity. So, yes, we will get to that point. But that's at this rate of infection, it's going to take us a while to get there. I think also that, I'm probably a dreamer in this, that, immunization, will occur sooner. We've seen a lot of the research being accelerated by, what took years, 10 years to develop, we're trying to do in months. And I'm hopeful that that will occur as well. Don't have any information more than that.
Yes.
But eventually herd immunity will come into play. Of course, there's, with that is mortality and, things like that. So.
Right. So we have to ensure that while we open back up, that those individuals that are in the high risk categories understand that they have got to continue to stay at home, to take every precaution that they can to avoid catching this virus. And the same thing with our nursing homes. There's a very robust plan in place for nursing homes for the testing of all of the staff, and ensuring that we have very, very close surveillance on those locations, because everybody's living in very close quarters, and the majority are high risk, and individuals can come in, workers who are asymptomatic, and pass that around. So making sure we take those steps to protect our high risk.
That's correct.
Well, Dr. Ross.
Yes.
Oh, go ahead.
No. I just was agreeing with you. If you can stay at home as an elderly person, you are safer at home than you are, out and about. So, I totally agree with you. Echo your feelings.
And in general, really, the safer at home needs to stay in place here at the city, and I believe most other organizations will follow suit. That those who are working from home, will continue to work from home. Again, we're not opening wide open. We're doing this slowly, thoughtfully, so that if we do see a surge, we'll be able to turn back and tighten back up quickly, as opposed to other states that have just opened wide open. So thank you, Dr. Ross, for your time, and thank you so much for your service. Really, really do appreciate it. Thank you.
Thank you.
Oh, wait, we have a question for you.
Okay.
Well, actually, this question is for Mayor Castor. It's from Evan. Sorry about that. It's from Evan Axelbank with Fox 13. I'm assuming you're following the unemployment site debacle with the governor. How do you feel that it's negatively impacting our residents here in Tampa?
Yes, it is. And we actually had Senator Cruz on a Facebook show the other day, and that was the topic of the discussion. And it was by far the most watched, I'm sure, with the exception of this one, Dr. Ross. It was by far the most watched Facebook Live. And so many of our residents are suffering, and they need that money now. We put One Tampa in place so that we could help out with mortgage, rent, and utilities. But individuals need that money. And we have a number of nonprofits that are helping with food. But I believe that Senator Cruz described it as unconscionable. And really, it has to be fixed, and it has to be fixed now. Once they got the system back up and running, 40% of those who applied were denied, and then they were told to start over again. So there's a lot of frustration. There is a great deal of stress out there in the community, and there's a great deal of fear as well. People have had the rug pulled out from under them, losing jobs, businesses, and so they need that unemployment, and it needs to be provided now. It should have been provided several weeks ago. All right. Well, thank you again, Dr. Ross. I appreciate it. we stopped this could have been your opportunity. We had our dance party, a karaoke dance party every night at 6, and I'm sure you are an incredible dancer, but we ended it yesterday. So
Oh,
that
sorry.
was a fun time. Every evening at 6, everybody went out and danced. But please, please, please remember to sign up, get a test. As you heard, you can go to Advent Health's website. You can go to Hillsborough County's website, sign up, make sure you're filling out the census. And also remember, we are slowly opening up the businesses. We're doing what we can right now for the restaurants. Please, please, please don't look at this as business as usual. Bars are not open, only restaurants, and 25% capacity. So we're allowing tables and chairs to be put on sidewalks and in some cases out in the street, but you have to have a reservation. So make sure you're calling ahead, follow the rules. This is a matter of life and death. This virus has taken 23 lives in our community, so we can't afford to lose any more of our citizens. So be aware of the level of personal responsibility and take it seriously. And remember, stay safe, be kind. We want kindness to be more contagious than this virus in our community. Stay at home, please, please, please. Thank you all and God bless. Thank you, Doctor.
Thank you, Mayor. Appreciate it.